Welcome everybody to our panel discussion tonight. We're happy to greet you from Straßburg, from the European Parliament. Today we're talking about development assistance for health, hosted as always in the working group, Pan-European Working Group by MEP Lukas Mandl from Austria, who's the chair of the Pan-European Working Group and who's also the EPP spokesperson for the Development Committee. My name is Caroline Pachet. I'm heading the office of Mr. Mandl and will be moderating the session tonight. And I'm happy to welcome our distinguished speakers here. To my right, we have Dr. Armin Fidler from Austria, who will give the keynote presentation tonight. And then we will later also hear from a member of European Parliament, Maria Walsh from Ireland, who is probably the most outspoken person about advocating for mental health in this House. And then also Michael Stellwag from the Konrad Adenauer Foundation in Austria, who we've, I think, had on this panel before a couple of years ago. So good to have you back. Just a couple of information for you. We have interpretation in German, English and French as always. We're live streaming this session, so also welcome to our participants online. And we're recording this session, so whoever is watching on YouTube later on, thanks for joining us. And then, in order to save the precious time that we have, I would like to give the word directly to Mr. Armin Fidler for his keynote about a report that you have written together with many distinguished colleagues of yours, and we're curious to hear what you have to tell us.
Well, thank you very much, first of all, for the kind invitation. Perhaps just a couple of words before I start about my background. I'm from Austria, we heard that. I'm a medical doctor by first training, before becoming a health economist, first working for the World Health Organization and then 20 plus years for the World Bank in Washington. All in health, looking at basically helping countries to develop and modernize their healthcare sector. And I was the director for health in Europe and Central Asia, so the new member states of the European Union, plus all the countries, the new countries emanating from the former Soviet Union, plus the Balkans, etc. So that's just my background. Later I came back to Austria, that's about 10 years ago, and morphed into academia. That's what I'm doing currently. Now, this project was carried out by a bunch of colleagues. It's a pro bono project. We received an unrestricted grant, actually from Mr. Gates personally. So he had no involvement whatsoever, but he was very interested in the outcome, obviously. We did not get any salary or any benefits from that, so this is a true pro bono work. Okay, now I do not know how to get the screen working. Is that, I did bring some slides. Yeah, so can we have the next one? I cannot move them, right? Is there a button where I can move them? Okay, so you have to do it, okay. Yes. Okay. The next one, please. Now it's gone. Yeah, this one. So anyone who would like to see the detailed report, you can just take this QR code. It's 100 and whatever 30 slides and whatever 300 plus pages plus annexes plus. So anyone, this is a very detailed report. We worked 2 years on that. So I will go very fast through this just to get a little bit of a taste of what the whole issue is all about. The next one, please. Next slide, please. Yeah, so here, this is the issue at hand for development assistance. So we looked basically how much money, how many resources were available and transferred for development assistance over the past 25 years or so. And what you can see is a very steep increase in the 2000s, so the decade of 2000 to 2010. And it was leveling off. We did not include the extra resources for COVID because, I mean, that would falsify basically the...
Excuse me, I think one of the interpreters can be heard in the room, possibly. Could this be the case? Sorry for interrupting, Mr. Fidler, but I think we have some interference. Yeah. Or this is already...
Bei Frankreich brennt das Licht.
Or is due to the...
All right, well, let's try again.
It stopped miraculously.
Yeah. All right. So we were looking basically at about the 25 years, so basically from 1990 to 2019. We did exclude the COVID years because that would basically falsify the results. And what we saw is, as I mentioned, basically a very steep increase of resources in the first decade of the 2000s. It was then leveling off, and now actually we see a decrease of resources. If you look at basically the segregation of the different resources, you see cumulative country on the right-hand side, cumulative country allocations broken down by administrative expenses and in-country allocations. The next one, please. So basically, the 5 key questions that we wanted to answer. So what are the trends over these 25 years? Did the organizations that delivered development assistance really also deliver what they wanted to actually accomplish? And was that sustainable? The third point was, to what degree, if we could figure out, did actually these resources really contribute to the local systems? Was there a positive impact or maybe even a negative impact, as we could then demonstrate in some countries? Finally, we wanted to see, okay, what's happening in the future? Is there any trajectory in the future? We saw, for example, just in the past year, the complete dismantling of USAID from the United States perspective, so that these resources are not available anymore. Many other countries followed suit to decrease substantially the development assistance for health. So we've also had a look about the outlook of DAH in the future. And finally, what kind of recommendations, based on the research that we did, based on the data that we had, what kind of recommendations would we be able to derive from that? The next one, please. Just a quick look at the team. These are all very senior folks from government. We had former ministers of finance, former ministers of health, current ministers of health, senior people from different international organizations. Most of them retired by now, so they have no skin in the game in that sense. We were completely independent. As I said, nobody of us received any resources, any payment. So this was truly a piece of work that occupied us for about 2 years, with a bunch of young researchers that helped us. Those were paid, actually, the researchers. And of course, we used a fair amount of artificial intelligence also, and then we'll come to that a bit later. The next one, please. Now, we need to keep development assistance for health, so the resources that go for health systems in low-income countries in perspective, particularly in perspective in the context of overall resources, both from poor and rich countries that go towards health. And if you look at that, it's just a minuscule part. If you look at the last bar graph here, I mean, this is development assistance in the year 2019. So if you look at the breakdown of what we are spending globally on health, it's actually peanuts, you could say. Interesting also, if you look at just the United States alone, spends over 40% of global resources spent on health, right? Then the other half, basically, the other 40% is the other high-income countries together, and then maybe 20% together, only middle-income countries and low-income countries. So we need to keep this in perspective. Even though almost 900 billion seems like a lot of money, but compared to what we are actually globally, the rich countries spending on health, it's actually peanuts, right? Now, here again, on the next slide, please. A breakdown, basically per capita in low-income countries, on lower middle-income countries. So what is the proportion of development assistance for health? This is basically the small top one. The rest is government spending. The orange one, and that's very important, you see, the poorer the countries are, the more resources are spent out of pocket. And that, of course, is a big problem. So if poor people have to spend resources out of pocket for health, you can imagine that that becomes a very challenging situation for many families. And only a very small amount is prepaid. That would be insurance. It's obvious that in many of the low-income countries, there is no insurance market where even you could prepay basically through insurance premiums for health. So people who fall sick, families who fall sick, in most low-income countries, they need to pay out of pocket. The next one, please. So you can see here, I think that demonstrates quite well this graphic. You see a relatively slow increase of development assistance for health in the 1990s. Then with the creation of the Global Fund against AIDS, TB, malaria, the creation of the Global Alliance for Vaccines, Gavi, many other initiatives, the Gates Foundation, and, you see a very steep increase in the early 2000s. Global Fund and Gavi were founded in the beginning of 2000s. It was then leveling off in the second decade of the 2000s, and you can see the fall now. So if you look at from 2021, so after basically COVID, the pandemic subsided, most donor countries really curtailed their allocations for development assistance for health, not only the United States. The next one, please. Now, this increase in the early 2000s was mostly driven by very few conditions. So basically, you know, the health focus was mostly, that had to do, of course, with the Global Fund, AIDS, tuberculosis, and malaria. There was also a quite important allocation for another high-profile cause, which is newborn and child health, reproductive health, basically. A very small amount, and I will come to that in more detail, for actually something which was a high burden or continues to be a high burden of disease, also in low-income countries, is non-communicable diseases. So chronic diseases like cancer, cardiovascular diseases, diabetes, etc. Now the next one, please. And that's exactly what you see here. You see basically, and this is one of the key findings of our research. So we see basically that there's a complete mismatch between the burden of disease, so on what are people actually getting sick in lower income countries, and for what actually are the resources allocated. Okay, so if you look at the red bar in the left-hand graphic, you see these are NCDs, so non-communicable diseases. These are chronic diseases, as I mentioned, cancer, cardiovascular diseases, diabetes, so chronic diseases. So this is the major burden of disease, also in low-income countries. So it's not the case that in low-income countries people get sick and die of infectious diseases, what many people believe. That was maybe 50 years ago. Now, the major burden of disease is, just as we see here in high-income countries, is non-communicable diseases, meaning chronic diseases such as cancer, diabetes, cardiovascular diseases. But then if you look on the right-hand side, where do the resources go? Completely different direction. The resources go to infectious diseases. The resources go to maternal and child health, which is important, but you know it's out of proportion. And that, of course, is a serious problem. And then we need to ask ourselves from a political perspective, why is that so? Why are we allocating resources to something which is not in line, actually, with the burden of disease, meaning the things that people get sick from? And, of course, here, okay, we are here in a political institution. These are political decisions. And the key reasons behind that is it's a number of issues. First of all, we want to spend resources where you have quick wins. It's very nice and easy and quick to immunize children. Very few people would be against that. In the meantime, maybe yes, in our countries. But you can quickly measure the impact. You can quickly allocate these resources. You see success in a few years down the line. It's attractive. It's about children. It's about mothers. It's about newborns, etc. Right? Then you have other issues such as HIV/AIDS. Yes, that was important in the 1980s, no question about that. But at the same time, a huge global pressure group was established, very much understandably from the point of view in the 1980s and early 1990s. But then a lion's share of resources went to the Global Fund for the fight against AIDS at the expense of other things, such as mental health. It became attractive to spend resources on HIV/AIDS. It remains extremely unattractive to spend any resources for mental health, for example, right? Because nobody wants to be associated with that. It's people who are at the fringe of society. It's difficult to measure the impact, right? Even though in terms of the burden of disease, so the magnitude, how many people are affected, it is growing, it is important, it has huge economic weight, and yet when you look at development assistance, mental health really falls through the cracks. The next one, please. Now, I want to go very quickly. These are just how the resources basically divvied up in terms of administrative expenses, country allocations. So not all the resources are allocated in a country. Some of them are global. For example, in terms of climate change, for example, and other things where resources are allocated not in a country-specific context, but global. Interesting here is you can see the evolution of administrative expenses, which is about 13%, and something which is a little bit worrisome for us because we found when we looked at the resources a quite substantive number, 27% unallocated and unspecified. And we couldn't figure out where these resources went. Where did they go to, right? We inquired with WHO, with the UN organizations. It's mostly a UN issue, and we assume that this goes towards country offices and country staff, etc. But we were not really sure to put our fingers in there. The next one, please. So how did we go about the research? So basically, we looked at all the channels. A channel is basically an organization that transfers these resources into a country. And you see here the list. This can be NGOs, it can be bilateral organizations, it can be multilateral organizations such as WHO or the World Bank or regional development banks, etc. You can see here the allocation. Interesting. A lot of non-governmental organizations, particularly many from the United States, they are quite resource-heavy, right? Because there are literally hundreds and hundreds of organizations, particularly in the United States, that have a multilateral development footprint. The next one, please. And then you see, where do the resources go to? And here also some surprises, you see, for example, countries where you think, so the lion's share of the resources went, for example, to Nigeria and India. Now, of course, these are big countries, no question about that, and big countries have a lot of poor people. But on the other hand, these are countries with a lot of sophistication, and it makes you wonder, couldn't these countries care themselves for, some of the problems that their citizens have? After all, India flies to the moon. Nigeria is a huge, petro-rich country, actually, with exports in oil and gas and what have you, a large country. So again, there are a number of questions here, right, that we and politicians who allocate resources for development assistance, I guess, need to be asked. The next one, please. Now, another issue that we had was one of our goals was to find out what is the impact of these resources. It's nice to find out, I mean, how many resources were raised, how were they transferred, where were they spent. But then after all, we want to do something with these resources. So we looked at, including with the help of AI, artificial intelligence, because we looked at about 27,000 evaluation reports. So we checked this with AI. First we did it by hand, about 2,500, and checked whether the AI would be able to match that, and it was a perfect match, so it really worked. So we reviewed manually and with AI over 20,000 evaluation reports, right? And it's actually quite interesting that what we found is, and this is also one of the recommendations, we found very few independent impact evaluations. Right? So either people evaluated themselves and then it looked rather good. Important would be to have an independent, from the outside evaluation, what your resources, what the impact of your resources were. The next one, please. This just illustrates that. So basically we see the more independent the evaluation was, the more significant also then what were the findings. But you can see, for example, when you only look at internal evaluations, when you do it yourself basically, not a single one was deemed unsatisfactory. Right? So it's actually a quite telling graphic. The next one, please. Now, and you can see this is quite important here. You know, obviously, if you're in a business that is associated with relatively high risk, I mean, you do important things in countries with bad systems or no systems at all, you would expect a certain failure rate, right? I mean, I would be very suspicious if everything would succeed if you do business in whatever, Tajikistan or Malawi or it doesn't important, not important where, right? So it's also a question, do you take enough risks? Right? I mean, in development, you need to take risks. You need to take a certain amount of informed risks if you really want to move the needle. And you can see here of these publications, of these channels that we reviewed, how did they fare in terms of results. And you can see, I mean, depending on their own evaluations, I mean, very few of them would state that they have not achieved their development goals. Quite a number of them, it's only partially achieved, and very few that would argue that they have fully achieved their results. Which, again, I would also hint at the point, you know, that you wouldn't expect that in each and every case, depending on which country you're working in. I mean, it would be suspicious if you 100% achieve your results. I mean, that it would simply not be possible. Then the next one, please. So I will go very quickly. I'm not going into the details of the statistical analysis, but basically, for us, it was a means of just verifying the hunches that we had. We also had case studies, which are in the annex, if you're interested. There are a bunch of different country case studies. Just we wanted to make sure that our results are robust, that we also have the statistical analysis when it comes to the measuring of the impact of development assistance. Next one, please. So, I mean, I want just to highlight three issues here. One regarding infant mortality. Yes, we could find a statistical association with impacting infant mortality. On the disease-specific issue, it was less clear. The data simply were not good enough to really account for that from a statistical perspective. So this is an issue that certainly there is more research needed and more in-depth. Also, a call for better data quality, right? We only could work with the numbers that were in existence over these past 30 years. And that's one of the links that we were calling, and one of the recommendations. I will come to that, to say we need some type of independent international observatory that is in charge of measuring the impact of the different allocations, the different channels. The next one, please. Now, I also said that we were thinking about the outlook. So what does it mean? What do these results mean? And what's the pathway of development assistance for health in the near future? And of course, you can divide it up from a supply side and a demand side. From the supply side, we have already seen that there are a number of negative shocks. We saw very clearly that with one stroke of the pen, an entire agency, USAID, disappeared. Many other countries also decreased funding. Many private foundations have resource issues. And we could see that, as I demonstrated before, that there's a steep fall-off basically after the year 2023 of the overall amounts that were allocated for the development assistance. Now, of course, we need to look at maybe alternative funding mechanisms. The World Bank has had a lot of experience with debt relief, where the most indebted countries, in return for some policy changes, got debt relief. There's also questions of international taxation, wealth taxes. We need to have a look at remittances. Remittances is basically the money that expatriates are sending home. People from poor countries working in rich countries, making money, sending resources back, which is a very important contribution for these receiving countries. And then, of course, we looked at the demand side. I mean, there's a demographic issue, there's issues of climate change, migration, the question of economic growth. I mean, to what degree will we succeed, as we have seen in a number of countries in the past 2 or 3 decades, that they moved on from low-income countries to lower middle-income countries to middle-income countries. So hopefully, when alone China, for example, really moved hundreds of millions of people out of poverty. I mean, so they really succeeded in a big way. But there are only few countries that have sustainably succeeded in doing that. So I think, but again, you need to look at both sides, at the demand side and the supply side, to have a kind of an informed guess to which direction development assistance will go. The next one, please. But there's a lot of uncertainty. I mean, there's uncertainty. We're living in an increasingly uncertain world with very rapid political changes, with all kinds of issues that we didn't think about only a few years back, with the impact of climate change and migration, with political strife, war, etc. So these are all issues that contribute. The political climate is changing. So all these things that have an impact on the resources available for development assistance. So finally, I come to the recommendations. The next one, please. So one of the things that I mentioned already is very important. With the resources that we have, at least let's allocate the resources according to the burden of disease. So let's spend the resources for those issues that are really important in countries where we transfer the resources to, and not because of political priorities in donor countries, or because it's attractive, or because it's low-hanging fruits or quick wins. Right? So this would be a very important point. We should measure outcomes. Sometimes what we have seen is just measuring this. So the success was disbursement. I mean, that cannot be, right? Yes, disbursement, moving the money is important, but when the money does not achieve results, I mean, then the disbursements, make no sense. We really advocate for an independent function. Right now, yes, OECD is doing a good job. They're trying to do a good job, but they have a hard time to really correctly assess the resources. I want to point out the European Union. Supposedly, the European Union is now the biggest donor, but we cannot account for the resources because some of the resources go bilateral, others go as the Commission. Some resources are packaged into things that you cannot tease out. For example, climate change. I mean, yes, there's health in climate change, but we cannot find out how much health is in climate change, how much health is in education, and so on and so forth. So these are issues to be concerned about. The focus on results, I mentioned we need to improve in methods, in better data quality. I mentioned that already. We need to find out how to recover from the financing shocks of late. So alone the issue of USAID that looms large. PEPFAR is also gone, right? So these are only one country, but also other countries are cutting back, and we need to find our way out how to manage this. Again, we advocate for a closer collaboration between donor countries, donor organizations, and recipient countries, so that resources really can be channeled to the priorities also that they have. Okay, finally, the last one, I think it would be, this is a really important call, repeating again that there should be some type of an independent mechanism of doing what we did now as a bunch of people who had an interest in this. We did it as a pro bono exercise, but that cannot continue like this. There needs to be at the global level one institution that feels responsible, helping countries and channels, institutions, whatever, to really account for the resources, measure the impact of the resources, and feed that back to donor countries, to donor parliaments, to etc. So this will be one of our key recommendations. And finally, I just want to say thank you for listening to an extremely compressed version. It's really hard. I mean, there's so many issues embedded in that. It's kind of hard to do justice to that. But if you're interested, please read the PowerPoint, or if you're really interested, you can read the many hundred pages of the report. Thank you very much.
Thank you so much in helping us, first of all, better understand how the resources were spent in the past, but also how we could do a better job. And I saw the members of European Parliament taking notes when you were mentioning the recommendations, so we can really use that in our daily work. Now, Maria Walsh, having heard all of what has been stated now by Mr. Fidler, first of all, what's your take after hearing all of this? And as I've introduced you already as a strong advocate for mental health, how would you say that we could better incorporate mental health in development assistance, especially in fragile settings or in the humanitarian context?
Thank you very much, and thank you, Caroline, and in particular, thank you to Lukas for inviting me here. And it's one of these conversations where you wish, well, pretty much everybody in this room is convinced, and it's the many out there, as you mentioned, on many occasions, Mr. Fidler, if I hope I'm pronouncing that correctly, just the policymakers and decision makers. From a reactive standpoint, just a few things. The burden of diseases continue to come up, like just how impactful that happens to all types. And I think we do work not just within the mental health space, but also in gender equality around cardiovascular and the impact underfunding, under policy, under research, medical assistance to women versus men. I just hosted an event last week on HIV, and Will we, won't we meet the targets? We won't. And a conservative number that was shared there, but I'm conscious I'm up here with professionals, so he's going to correct me if I'm wrong, was if we didn't reach the targets at an international standpoint, you're looking at 800,000 additional people with diagnosed with HIV in the coming years. I mean, again, I wrote down here, you don't know what you don't know. It's incredibly difficult, to your final slide, if we do not have the information to understand where it is. And also, to another point, your the note on political climate is changing, and it often feels, while we debate and discuss here liberalism versus conservatism, within all of that, and to tie into the point on mental health, the very social fabric of a human being is all aspects of them, is not just their physical health, which we legislate here for, but also their mental health. And I have to say, for any of you who haven't heard me speak about this before, and Caroline was very kind in her opening words, I'm the only, there's many of us that just continue to talk about it, but it's incredibly difficult to what you said, Armin, earlier, to really put mental health at a political priority that is sexy and trendy and interesting to fund, yet we know from research from the Commission the second leading cause in our European Union for young people 10 to 19 is death by suicide. And then in the same space we talk about competitiveness and we talk about the future of the EU and the security, and yet we don't talk the very fundamental core aspects of a person. I have to say, I have a brief speaking note here, but in the last mandate with the Health Commissioner, Stella Kyriakides, whose background was a child psychologist, that certainly aided the conversation of talking about mental health more and more. But different political priorities have shifted in this mandate, and why we've set up an intergroup here and working with our secretariat on that across 20 committees. The narrative that consistently comes back is, well, mental health is not a competency of the EU. Yet, again, from the Commission reports, we know, again, a conservative number, 600 billion thereabouts gets spent in a reactive measure to mental health. So absenteeism at work, chronic conditions, you name it, and it's very closely tied to the mental health aspects. I will say there has been some programmes delivered by the Commission and us in the last mandates, but programmes is simply not enough. They run often by pilot programmes, so we might do 3 years of really, really great work, and then a group, be it academic or a civil society organisation or even a schooling, would run these projects for 3 years, create a great network, and then we pivot and we change the goalposts again to look at something else, which is a biggest struggle, because we continuously build this, drop, and then keep moving on to something that again is a little bit more focused on the current political climate, which means then we don't fund healthy mothers, who are the foundation of healthy families when we look at postpartum. It means we don't consistently fund young people and the access to mental health supports in a preventative measure and also a reactive measure, because we know that pendulum swings. We haven't looked at enough, in my eyes, the use of online or AI to support in terms of even telehealth. In Ireland, we ran a project that is consistent in some hospitals, not all, but because we're under-resourced in psychotherapists or medical health experts in our ER, in our accident emergency, we've used telehealth. So if someone comes into an accident emergency in a very challenging state with their mental health and the psychosis, then they can get that support online with the doctor, who might be a couple hundred miles away. However, what often happens anecdotally is what we've been told by organisations supporting these people on the ground is, again, they hold for a couple of hours. If there's nothing physically demanding or needing, they're released, and then the family and friends are on suicide watch for 3 days. And that's not good enough in 2025 in quite a rich country like my own of Ireland. I could go on, and I actually have more questions for you than I think anybody has for me. But I mean, ultimately, I'm always left with the why, and this is where I should be providing an inspiring speech about where we're getting to and where we're working towards. And it's very helpful and very supportive to have someone like Lukas and his team, and us being able to talk about mental health on a Monday evening in the European Parliament in Strasbourg. It's just how do we continue on that conversation collectively with people not just in this room but outside, utilising data that we know. And I think it's outrageous, as you pointed out, Armin, that 27% of that budget was unspecified or unallocated. Not to go into the conspiracy theory of where it could have been spent or how it got spent, but again, you go back to numbers like the 600 billion in reactive care for mental health. There's a lot of money in mental health, but yet more and more numbers are growing, which is our fundamental problem. I will stop and say good mental health is not a luxury, but it's becoming one. It's a fundamental component of our public health and human dignity, and as policymakers, we absolutely have to hold the pen in making that change, not just for the current generation, but the many that will come, because as we know, in any form, once your health, be it mental health or physical health, it begins to deteriorate, so too do all other aspects of your life. And if we don't have a healthcare system that supports the holistic being in 2025 and beyond, then what are we doing? And it's simply not good enough. So I promise you I'll be more positive if questions come from the floor, but I'll be directing to the experts here. But thank you very much again for having me.
Thank you so much for shedding light on this important topic, and also for taking the time to be here, because we all have a busy Strasbourg schedule. I know you have speaking time later, so thank you for being here.
He's a couple of minutes before me, so once he moves, then I can...
That's true.
Can't miss the plane.
I'm going to shift the conversation just a tiny bit to give Michael Stellwag also the word, because Konrad Adenauer Foundation is a political foundation. Often those foundations find themselves at the intersection of governance, capacity building, and civil society. So I'd be interested to hear your opinion of the current state of play of development cooperation, but also please feel free to react on what has been said before. We'll just try to stick to the time to make sure that we could still give the floor to some of the people in the audience, and then final remarks to Lukas Mandl.
That sounds great. Thank you so much. Good afternoon, everybody. First of all, thank you so much that we can be here again this year. CAS Vienna is very much connected to the pan-European movement in Austria, and also, of course, to MEP Lukas Mandl. Madam Walsh, thank you so much for putting mental health on the agenda one more time. It's very important, especially for my generation. And Mr. Fidler, thank you so much for this deep dive. I'm just preparing a little overview over the whole agenda. Just one sentence about CAS, 3 quick points, and one recommendation, quick and dirty. CAS has more than 100 offices in the world, and it believes in rule of law, European and international cooperation, and social market economy. We fight for liberal democracy globally, and that's why we are very often in the intersection of all these actors. We do not really build bridges, hospitals ourselves, but we fight for healthy civil society or healthy rule of law environment in those countries. For example, because I just have been here in Georgia, where the government is fighting against different political parties, and we are very happy to support civil society. And it's a partner country of the Austrian Development Agency, so just another connection. Mr. Fidler mentioned it already that the development assistance or development cooperation, as I call it, is under pressure. 3 points why it is the case. First of all, we know our domestic budgets. They are not as good as 5 or 10 years ago, and your survey was, I think, until 2019. So just before COVID. We have a lot of constraints. And in a lot of European countries where this model of development cooperation is working, we have increasingly parties that argue like, my country first. And when you argue like this, development cooperation is not on the top of the agenda anymore. Or specific parties fight against the system. And when you are against the system, so against the government, so also against foreign and security policy, it's another problem to fight, for example, for global health. Furthermore, we have fewer democracies than before. And that means fewer potential partners to work with. Because, of course, when Europeans or other actors are cooperating, there are government conditions. Democracy, human rights, etc., etc. And we also had this discussion already with Mr. Dorfmann. We have increasingly a geopolitical rivalry. So other donors, other actors jump in as cooperation partners. China, Turkey, Russia, of course, the Gulf states. But they have another point of view when it comes to cooperation development. It's less helping and more building an influence, a zone of influence, which also holds us back. So we really have to do something about it. First of all, we have a marketing problem and explain our citizens better that it's not, oh, we are so friendly building something abroad, but it's about really establishing a cooperation on the same level, and it also has an economic and security dimension. So what is needed for the future? We need a more economy-orientated, we need a more interest-based, also a little bit more pragmatic, of course, better coordinated on European level, and well communicated development policy, and then it is a wonderful part of our foreign and economic policy. And in the end, we can do more for global health, as Mr. Fidler said. So thank you so much, and I give back to you, Caroline.
Thank you so much. I like the analogy very much that Gast fights for health as well, but maybe more for healthy rule of law and governance. It's a good way of combining the topics. So are there any questions from the floor? Please raise your hand, introduce yourself quickly, and press the button in front of you. And don't be shy.
Can speak French.
Can speak German, English, or French.
And any hard questions, just go to it.
Yeah.
Sebastian Siller, hello. I like that from Ms. Walsh, the holistic approach. This is always a topic which is probably forgotten sometimes. But to Mr. Fidler as well. So have you ever, in your studies, have you seen or approached some measurable figures how a holistic approach would help to lower the giving rate, you know? So what would a holistic approach brings, especially in mental health, for example, you know, to prevent?
Okay. I don't know whether I understood the question correctly, but for us, I mean, I worked for the World Bank more than 20 years. And while we were organized in different sectors, we all worked together for one development goal, right? Understanding that, for example, only for health outcomes or for economic outcomes, you need to have, for example, in order to have a good workforce, you need to have a healthy workforce. You need to have an educated workforce. You need to have a workforce that has food on the table. You need a network of transport. So, I mean, many times we said, okay, look, you know, maybe we should not build a new hospital somewhere. What is really important is a bridge between, you know, two parts of the country where the river runs in between, so that pregnant women can actually reach the hospital on the other side of the place. So, I mean, that's what we understood, kind of having always kind of a holistic, integrated approach, and not only said, okay, I'm a health guy, therefore I invest only in health, and that's the only thing I care about, which we see in many organizations. They never look outside, you know. Now, the element of mental health is another very good example. I mean, huge impact on the workforce. I mean, you mentioned, you know, if someone isn't feeling well mentally, You know, these people are out of the workforce, it's not just the sniffles for 2 or 3 days and then you're okay. We're talking months, if not years, sometimes forever. I mean, if somebody, you know, commits suicide, it is forever, actually, right? So, I mean, these things need to be taken into account. And right now, what we argue is the allocations or the priorities are derived not from the actual importance for the overall economy and society, but rather from issues of political convenience. Quick measurement, attractive sector, women and children, yeah, nobody can be against that. I mean, I'm not saying you should not invest in women and children, but I mean, if it's only women and children, they forget the rest. I mean, then you have a skewed allocation that doesn't make any sense.
You know, just to add to that, and great question. I think what I immediately thought when you asked it was, it's not as if it hasn't been done before either, because I think COVID was a brilliant example, particularly at an EU level, where once we got our houses in order, it provided a blueprint for how healthcare can be delivered at an EU level, particularly on what I'd probably push it further to the mental health piece, and not just PPE gear and vaccines and overall marketing campaigns around COVID. But I mean, I can give you an Irish example. Our former Minister for Education, when COVID hit, had told me it was the first time his Secretary General spoke to the Sec General of our healthcare department. And I was like, surely not. And he goes, I'm not joking. It's just because, to your point, everybody was working and living in a silo lane, which you can imagine, then it only becomes reactive. So then you don't look at the airplane view of saying, well, it is only a bridge we need between one hospital or to one hospital and communities connected, easier for mothers to move. I mean, we also do a little bit of work on again, as I mentioned, on women's healthcare, and a latest report from a menopause organisation at EU level pointed at 9 billion gets lost each year in the German economy through women impacted by menopause, but yet there's no policies to look at why that is, or what can we do to make it easier, or how can we facilitate better access to HRT, or something in the lines, and psychosocial impact on menopausal women in that. Now, I do it a bit gendered. Lucas isn't going to come in and remind me we have more than just one gender, but right now we're going to fight about it, and I have the microphone on so you can't shout it too loud. But I think there's just so many avenues, but if you're not speaking, then and we're not collectively working, to your point, I think one of the key recommendation of us looking at an independent organisation that holds all account. Money follows change, and money makes change. So where are we putting our money? It comes down to how active we want to be in holistic healthcare.
Thank you so much. I noted down policy coherence and circled it in red a couple of times, because this is what we talk about in the development committee all the time. Thanks for highlighting that. We have about 5 more minutes. I want to give the time to our host, Lukas Mandl, to wrap up, because so many important things have been said. What are you taking with you for your work in the next 2.5, not exactly 3 years for the rest of this mandate?
Well, that's a big question to ask. We haven't agreed on that beforehand. First of all, I thank Armin Fidler for joining our event in Strasbourg today. I remember our first call. When you called me, it might be a year ago already. And I was not aware, frankly, that we have such a champion from the World Bank in the global field of development from Austria. So thanks for presenting us with the study. We do not only have the live stream, as Caroline has mentioned already, we also have a recording of this, and we will spread it also among the members of the Development Committee and others who might be interested, because these facts and figures have to be known for future decision-taking processes. Actually, the allocation of money is everything, especially in times of USAID cuts. The EU is in charge, no matter whether the member states or the European level. We have leverage in the so-called field of soft power. We don't have as much leverage in the field of hard power, so it's even more important that we use our leverage here. And I don't mean it only politically in the negative sense you have mentioned today. I really mean it in the positive sense of making a positive difference. And Maria Walsh, thanks for many quotes. I have written down everywhere quotes from you. I can use it easily for speeches. Like we don't know.
I'm going to charge him.
Yeah. Send me an invoice. I mean, like we don't know what we don't know. I like it very much. Or money follows and makes change. That's what you said. But I mean, beside the fact it's all true, an extremely important thought you shared with us is that mental health might become a luxury. Yeah. And this is really something we must not allow to happen. I mean, this is not the civilization we want to live in, where only the ones who can afford or who are lucky to be in better structures of whatever kind within societies or globally would have the luxury of mental health. So thanks for being this champion, Maria, in this very parliament, and we all have to follow you. I mean, we can all prioritize time-wise the same things, would also be wrong, but we can follow you. And I hope you continue this pathway. Unfortunately, it will be more necessary in the years ahead, since Caroline mentioned 2.5 years ahead. So among youth, but among everybody, we have the issue. In the kindergartens, at least in my country, young children have more and more need for special support in the field of mental health. I want to thank the interpreters, as always, for the interpretation. I think it's the last Pan-European Working Group of this year. I don't think we have one in December, and that also means this was your last moderation, Caroline, after 5 years. So this is something that really deserves a hand. The Pan-European Working Group will not be the same, but we will try to go on as much as we can. We will share.
I can still join as a guest, right?
You can join. You are more than welcome. You're more than welcome to join as a guest. It will be a very good environment, if I say so. Huh?
I will keep asking the uncomfortable questions from the audience.
I can imagine so. And last but not least, I want to mention the Straßburg Discourse Days, which are present today. It's the 7th time that young Austrians come to the European Parliament in fall, and I would say have a deep dive into the European Parliament, and especially in the European People's Party's family, big family, the largest political family in Europe. And it's a very special time after what's discussed geopolitically these days, and given what we will have on the agenda of the European Parliament these days. So I'm more than happy that you are here, Straßburg Discourse Days participants, and this should also be a bit of a recommendation for next year, since we have a recording already to register for the Straßburg Discourse Days. It's only one time possible. It's a once-in-a-lifetime opportunity to join, because Michael Stellwag was once a participant, but today he's a speaker, so it's not a second time that you would be here. I have to clarify that. Thanks again. Have a very good evening. Have a less Strasbourg week, which is nearly impossible. And thanks again for joining this discussion. Health and mental health have to be seen holistically. Last point, content-wise, the prevention dimension was maybe a bit underestimated before, but Sebastian Siller said it. The more we invest, I'm absolutely sure, the more we invest in mental health, the less or the smaller is the amount we have to invest in health in the conventional meaning. So this is one more reason why we really have to care for the issue. Take good care and have a very good evening.